Welcome, my friends, to the Bob and Brad podcast. My name is Mike Kienitz, and today I'm interviewing Dr. Deb Riczo, who is a physical therapist. We are going to be talking about SI joint pain and dysfunction, how it's diagnosed, what it looks like, and treatment options for it. So without further ado, here is Dr. Deb. All right, let's get into how SI pain is diagnosed.
Okay. So diagnosis is, I think I mentioned this earlier, that it's not diagnosed 100% of the time because there's not really a black and white way of diagnosing it. There used to be, but the research has not backing that up. SacroIliac pain, they're estimating between 30, 35, 38% of people that have nonspecific low back pain have SI, and some of those are diagnosed, some of them aren't. And with pregnancy and postpartum, as I mentioned earlier, it's even more with pelvic girdle pain. And a lot of times these women don't get better. 7% have serious problems. So it can be life-changing for sure. So to diagnose it, we think of three big categories, and that's injections, imaging, and special tests, which is the hands-on. That's why I've got that hands on that third figure. So we're going to look at each one of those. The problem with imaging is that they've been finding that people that have no pain are having positive results on some of the imaging that they would use to diagnose these conditions. So it's not as foolproof as we would like it to be. But imaging is still very, very important so that we can rule out other significant problems like malignancies or infections and things like that. So you definitely want to have, if your doctor is recommending that you get imaging, you do want to do that to make sure that there isn't anything else that is going on. Knowledge is power, right? We want to know. We want to know what is going on. So, everybody wants to know what their diagnosis is. So I want to back up before I take this next question about the recommended treatment and talk a little bit about knowledge is power. So we have the imaging, like I already mentioned, the injections used to be used for the gold standard. If somebody injected your SI joint and your pain completely went away, then that was your diagnosis of SI joint dysfunction. That has lost favor because they have found that by injecting around the joint, that can also stop people's pain, where maybe just injecting the joint won't. And that led to the realization that you can have sacroiliac dysfunction without having the actual joint being a problem. Most of the research that's done is done on the joint. Most of the testing that we have, most of the special tests that I'm going to talk about in a minute are also talking about the joint and not necessarily the symptom. So that is why this knowledge is power. It's important to know that it's not like when you have a total knee done, it's because the joint itself is a problem. The cartilage is not there, you're bone on bone, but you don't want to have invasive treatments done to your SI joint if it's really not the joint that is the problem. So it's just good to be able to understand that distinction and talk to your practitioners about that. So the third category is the special tests. So we have imaging, we have the sacroiliac joint injection, and then we have special tests. And those are manual tests that if you've had any treatment by a physical therapist, or if you've been evaluated by an orthopedic or a physiatrist, physician, that you would be having, they would, do some pushing on your leg while you're laying down and see whether it causes pain in your sacroiliac joint. And those are called provocative tests. And the thinking now is that to diagnose it accurately, we need to have a combination of your clinical history, like what we talked about before, your age, whether you've had trauma, whether you've had a difficult childbirth, things like that, where your pain is, how your pain is behaving, and results of imaging, and these special tests. So the special tests have matured over history, and unfortunately, some clinicians are still using special tests that are not valid by research standards. And these are the tests where they're seeing whether you are rotated too much forward or you're rotated too much back, if you're out of alignment. All these words that people may be saying to you, these tests that they're doing, whether they're seeing whether one side's up or down, or whether they're seeing whether your pubic, bone on the back by the sacrum is moving up or down in relation to another bone, those have been proven not to be valid and reliable tests between practitioners. So research lags into getting into the clinic on a timely basis. And that's why it's important to know that if someone is telling you these things, that you probably should find another provider, because the sacrum does not really, and I probably shouldn't say that, but the sacrum really doesn't move that much. And so it may feel like it's out of joint, but it is most likely just that it's an imbalance between the tension and the pulling of the muscles on one side versus the other. And that if you can get those muscles back into position and strengthened, that you will feel a lot better.
Is there a test you would recommend someone to try or have done to them?
Like I said, it's not like one test.
Yeah.
So it's what they're saying now is that it should be a combination of, all that stuff, your clinical history, what your pain looks like, and any imaging results, and then the special tests. The ones that are being used the most right now are called the provocative tests, where they cause you pain in the SI joint. And there's a series of 4, and 2 have to be positive. But if you look further into the research is saying that only gives you like a 38% or something like that probability that it is SI. It's better to rule out SI. So the answer is no, not backed by research. But a clinician is taking all the picture of everything we just talked about to say whether it's, a sacroiliac dysfunction or sacroiliac joint dysfunction.
Sure. So when you used to see people, you don't treat now, right? You just work on online stuff primarily?
I do virtual coaching and physical therapy.
Oh, okay.
Uh-huh.
Do you kind of assess people that have SI joint pain and you have them do things that recreate it to figure it out? And then do you look at the imbalances they have in their lower body, like things you talked about earlier, like muscle imbalances? Is that how you try to correct it then?
Right. One of the key things in my method is to palpate the bony prominences of the pelvic girdle. So the bones on the front, so the bones right here, like if you put your hands on your waist and you put your hands right here, if this bone, which is your ASIS, is more tender on one side than the other, that is a positive response. And then if you put your hands on the front bone, your pubic bone, where the 2 halves of your pelvis meet, and if that is more tender on one side than the other, the same side that you were having your pain on, so these all have to be positive on the same side, then that's positive. And if you put your hands on your back by the sacrum and you try to feel for the knuckles, I call them the knuckles because they feel like a knuckle. And if they feel like they're more tender on one side than the other, then that's positive. So it would be positive if you have all three bony landmarks more painful than the other side. And then in the method in both of my books, then you do a particular exercise to try to balance that out, because that shouldn't be tender.
Sure.
And if it's not tender, then we are looking at the muscles. So that's looking at the muscles that are in a sagittal plane or this way. And if it's not tender, we still could be having a sacroiliac region problem. And we would be looking at doing a different exercise to assess that.